cooking up a recipe from her hit show, Bitchin' Kitchen. That's Tuesday on an all-new Marilyn.
Age spots. Okay, age spots are a constant reminder that our skin has seen better days. And here to shed some light on what they are, what causes them, and how we can minimize their appearance is dermatologist. Please welcome Dr. Julia Carroll. Here she is. So, age spots are they hereditary? So what are they?
So they are not hereditary.
Okay.
Their fancy name is solar lentigo, which is just a fancy name for a freckle caused by the sun.
Okay.
And you see them in both men and women. If you're over the age of 60 and you have light-haired skin, 90% of people have them. And it only takes 2 sunburns before the age of 20 to cause age spots. So, you know, same message as we always say, sunscreen, sunscreen, sunscreen.
If we could only go back in time and not lay out in the sun. Oh, I know. So misconceptions are not hereditary.
Not hereditary. People often call them liver spots. They have nothing to do with your liver. Old wives' tale.
Okay.
Old wives' tale. Okay. And the other thing I think is important is that people will say, oh, they're just harmless age spots, but sometimes they can turn into a cancer, so it's important to have them checked by your physician.
So if you see a change in an age spot, I see them, I've got a couple of them on my hands.
Yeah.
So darker and
darker. If it looks different than any of the other ones you have, or you have a new one you've never seen before, I think that's worth getting checked out.
Okay, very good.
Yeah.
Preventing them.
So preventing them is sunscreen and avoiding the sun. You know, wearing gloves, big hats, things like that are helpful.
And what is the SPF number that you suggest? Because I was hearing from other people in articles that, you know, 60 is 60, but really 30 is just as good as 60. So talk to me briefly about that.
I like a 30 for everyday use. If you're going to be out in the sun, or if you have something you're trying to prevent, like an age spot, I like a 60, because no one puts on enough and they don't put it on as often. So go for a 60. Other than that, I think it's a bit overkill.
So how can we treat them inexpensively?
Okay, so first of all, sunscreen that we talked about. This is a great product. It's by La Roche-Posay called Antelios Fluide. Very light. Lots of my patients love that one. Yeah,
I do
you
love it.
don't break out with it. This is Melody, also by La Roche-Posay.
I'll hold that up.
And it is it contains a natural product called kojic acid, which comes from mushroom, and it can fade age spots.
Now you made a good point here, because on this one you say you find that your patients don't break out because some are so thick that you can break out a lot. So it can cause some irritation.
So this is a big go-to for a lot of people.
And what's the next thing?
So this one's Lustra AF. It doesn't require a prescription. It has hydroquinone in it, which is the most common bleaching agent. And this is available from behind the pharmacist, but not with the prescription.
Okay, so you just apply it on the spot?
Yeah, I would generally use it on broad areas. I don't think you need to be too picky about it.
And then when can we see a change?
You know, with these ones here, it's certainly going to be, it's a bit of maintenance, and it's a long-term thing. So it could be months to even a year, but it's maintenance.
And the next thing you're going to show us?
So these are prescription products. So we have Retin A, and famous for its anti-wrinkle potential and acne prevention and treatment as well. And I actually get a product, so it exfoliates, so it gets rid of some of the brown spots by exfoliating. This is something that I concoct for my patients. So it's a recipe. I work with a pharmacist in my building, and I design it specifically for each patient. It has a little bit of Retin A in it, a little bit of hydroquinone in it, and a few other things. And it fades the age spots over time.
So really what you're doing is you're not removing, you're just fading them. And that's what it is. That's all that it is.
The next steps
we're going to remove it. Yeah. And so if when you apply it and you see any skin irritation, you should talk to your dermatologist.
Some of these are irritating, and so sometimes patients are only able to get them on every other day or once a week. So it's sort of that yin-yang, push-pull all the time.
Okay. And the next thing you're going to show us is what?
Okay, so this is liquid nitrogen. So I use this to treat skin cancers as well as warts and things.
It's cryotherapy. Okay.
Yeah.
Kathy's going to come up. Come on up, Kath. No, don't cry.
No, don't.
Kathy, Board Director Kathy. Okay. So this is, you know, you're doing this on your own.
This is
you
great.
See the doctor.
Yeah. This is great for one-offs. You have a couple of spots, not a whole face full. This is great for that.
So it's liquid nitrogen?
Liquid nitrogen.
All right.
So minus 300 degrees.
Let me see your spot first. You have a few.
Yeah.
Okay. That's called experience. Those spots are called experience spots.
It's called working with Marilyn.
Oh!
Is it an outdoor show?
Yeah, no.
Okay, be careful.
Okay, it's going to sting a little bit.
Yeah.
And we're basically just applying it to the skin.
Does it hurt, Kathy?
Stings a little bit.
No, not bad at all.
And these brown spots are more susceptible to cold than the regular skin, and so it's just going to get a little bit crusted. It'll peel off. It may look a little nasty over the weekend, but by Monday it should be fine.
That didn't hurt.
And Oh, well, I could do it. I can make it. And then when you do this, so let's just say that it doesn't go away totally. Yeah. She comes back after.
Comes back for more. If that doesn't work, then maybe we're going to talk about laser treatment for her.
Okay, and let's talk about laser for just a minute. Thanks, Cal. Yeah. Okay, let's talk about that because a lot of treatments through the doctor, hopefully, is laser treatments.
Yeah.
So let's talk about the dangers of laser treatment, and you should really go to a professional.
Yeah. So laser, I don't think it's a great thing to get from a Groupon at a discount at a fly-by-night place. You want a place that is supervised by a physician, ideally a dermatologist, and has that person on staff. I'll often go in and there'll be someone who has a question. Can this be lasered? You know, do they have other skin condition? And I can go in as a dermatologist, jump in, say, yeah, they're fine, go ahead, or you know, that's not safe, let's not do that.
And is that if you? It can be expensive, though, right?
It can be expensive, yeah. But if you have a whole face full of spots, at the end of the day, it's going to be less expensive than if I treated it individually with the liquid nitrogen. Yeah.
So that's a laser right there.
So this is a laser. It's called an IPL or a BBL. It's actually technically a light, not a laser, but we put it in the laser category. So little tiny snaps. It's not that painful. You can do it. It's a lunchtime procedure. So you go in, get it done. You might be a little bit red, and then you go back to work.
And then if it doesn't go away, you're
probably doing it 3 to 6 times.
3 to 6 times. So is there a separation in time to get them done? 4
to 6 weeks.
4 to 6
weeks. And you don't want to tan when you're doing it.
Yeah. All right. So don't be in the sun when you're doing it.
Don't be in the sun ever.
Well, right. But if you did, let's just say that you went golfing or something, had that done, what would that do?
So the laser can't tell the difference between a brown spot and a tan. So it's going to zap that spot, and you can get some skin damage permanently on your face.
Okay, we don't want that. Thank you so much. Learn a lot there. Okay, so here's the giveaway. La Roche-Posay is giving away fabulous products for everyone in our audience. And in the audience right here, that you're sitting right here, because you came down there. Right here. Worth $130. So thank you to that. And from you. That was really good information. Let's take a break. We'll be right back. That's really good. This is really good stuff.
Coming up, how to keep your skin looking young. We reveal the best products to conceal and diminish age spots. Plus, we reveal our 3 lucky viewers' makeup transformations.